Case numbers, ICU and hospital admission rates are all down from the previous day in New South Wales. In further signs, the Omicron outbreak is stabilising. Kenny Heatley has the latest in Sydney.
Chief Health Officer Dr Kerry Champ was asked this week whether a peak in cases had been reached in this Omicron outbreak, and she said that she didn't want to call the top because when school goes back you could get a lot of rise in cases once again, but she was seeing promising signs of stabilisation, and those signs continue today. We've got 82 less people in hospital with COVID at 2,781. There's 5 less people in the state's ICU wards at 212. The cases are down from yesterday at 30,825, and the death rate is also down from the previous 2 days at 25. Could the boosters be having an impact on this as well? The New South Wales government has shortened the time frame between the second and third dose at state-run clinics from 4 months down to 3 months. Now, is New South Wales going to be following Victoria's lead in declaring a code brown in the state's hospital system, which is basically an escalation in the emergency management response and the way that they can reallocate resources in hospital? It is unlikely, considering we are getting this stabilisation. We do have a very exhausted hospital staff network at the moment, and there have been recent protests by nurses at Westmead Hospital. But here's what the Premier had to say on this morning.
I have complete confidence in the system that we have. We've invested heavily in our state. We've just in this term of government, around 5,000 nurses. We've invested substantially in our ICU capacity at the outset of the pandemic. So there are encouraging signs early, but that does not mean we are not under pressure here.
So the Premier saying yes, the system is under pressure, but hospital rates continue to track under the best case scenario according to New South Wales government modelling.